Hello, my name is Ashley Simpkins, and today I will be demonstrating how to do a head-to-toe assessment following all of the GPSP guidelines. The first thing that we would do is knock on the patient's door and close the door behind us, ensuring patient privacy. We would go ahead and apply some hand sanitizer, practicing safe hand washing techniques, and we would introduce ourselves to the patient. Hello, my name is Ashley. I'm going to be your nurse today. Is it okay if we go ahead and do a head-to-toe assessment?
Yes.
Can I get your name and date of birth?
Bruce Wayne, November 5th, 1989.
Okay, and we check his wristband to make sure that matches. Alrighty. Is it okay if we start out by asking some questions?
No.
Okay. So before I would start asking those questions, I would go ahead and do an observation assessment, and I would look at the patient and make sure that they're not short of breath. He's very symmetrical. He has both arms, both legs. He does have facial hair, which is normal for a male. His ears are symmetrical. His eyes are pretty symmetrical. He has a nice pink color. He doesn't seem to be depressed or have any anxiety. No facial droop. Doesn't seem to have any pain. So he's looking pretty good there. So, all right, our first question is going to be, do you know what month it is?
September.
Okay. Do you know where you are?
Hospital.
Okay. Do you know who the president is?
Trump.
All right. So the patient is alert and oriented. And we're going to go ahead and start asking another set of questions. Do you have any allergies?
Not that I know of.
Do you take any medications?
I do not.
Okay. Do you have a regular doctor that you visit?
I do.
Okay. Do you have transportation to and from?
I do.
Okay. Do you have a stable income?
I do.
All right. Do you live in a house or an apartment?
House.
Okay. Do you feel safe in your own home?
I do.
Okay. Do you feel safe in your neighborhood?
I do.
All right. Are you active in your community?
I am.
Okay. And that will conclude our question part. Is it okay if we go ahead and start getting some vitals?
Yes.
All right. At this point, I would go ahead and put on some gloves to practice safe hand techniques. And we're going to go ahead and get your O2. And we're going to put on a blood pressure cuff. Alright, so we're going to make sure our patient has their feet flat on the floor and they are not crossed. We're going to give a little squeeze here, okay? Patient's O2 is 120/80. His O2 is 98 on room air. His respirations are 16 and his heart rate is 72. Alright, from here we're going to go ahead and assess the head and skull. His head is pretty good. There's no lesions, lumps, bumps, bruises, no redness, no irritation. Everything seems pretty well. His head shape is normal cephalic. Everything seems pretty good there. We're going to move from here and go down to his ears. His ears are very symmetrical, nothing out of the ordinary. No edema, no swelling, no redness, no irritation. We're gonna go down to the back of his neck. There's no lumps, bumps, bruises, nothing out of the ordinary there. We're gonna come up to the front. Go ahead and tilt your chin up. Go ahead and swallow. Normal swallowing. Patient's been speaking to me the whole time. We're gonna assess the face. Go ahead and raise your eyebrows for me and smile. Face is normal. No signs of stroke or any drooping. Eyes are symmetrical. Nice pink color. We're gonna go ahead and look at his eyes. Eyes are reactive. We're gonna go ahead and take a look at his ears. No cerebrum, no earwax, no drainage, no foreign bodies. He does not wear hearing aids. Also, no drainage, no foreign bodies, no earwax, and no hearing aids. We're gonna go ahead and look up your nose. No drainage there. And we're gonna go ahead and look in your mouth. Mouth is nice and pink, normal mucosa. We're gonna move down to his shoulders. No lumps, bumps, bruises. If you don't mind, I'm gonna move this collar out of the way. We're gonna go right under that clavicle and check his tuber, which is normal. Now he does have a beard, which is normal for men. If it was a female, we would go ahead and mark that as abnormal. We're gonna go ahead and check his arms and go right down his wrists. No lumps, bumps, bruises, irritation, or lesions. Everything's good. We're gonna check his hands. No lumps, bumps, bruises, or irritations or lesions. And we're gonna go ahead and check his pulses. Pulses are good, bilaterally +2. We're gonna go ahead and move on down and check his capillary refill. Capillary refill is good. All right, I'm gonna go check your arm mobility. Can you put your arms out for me? And we're gonna flip over and over. Good. Can you grip my fingers? All right, push and pull. Nice. All right, so from here, we're gonna go ahead and move to his back. Make sure there's nothing abnormal. No lumps, bumps, bruises, or swelling. And everything seems pretty good here. Now, if he was a bedbound patient, I would go ahead and check his sacral area. Make sure he doesn't have anything break down, no irritation, nothing that would be a sign of a pressure wound. And from here, we're gonna move down to his legs. Ooh. So we're gonna check his legs, make sure there's no edema, no swelling, no lesions, no discolorations, no signs of inflammation, nothing on this leg. We're gonna do the same thing on the other. Nothing on that one. We're gonna check his heels, make sure there's no irritation, no inflammation, no sign of breakdown. We're gonna check his duralis pedis for his pulse. And he has a pulse there. And we're gonna go ahead and have him push up and push down. Nice. And we'll check the mobility in his legs. Go ahead and stick one leg out. Oh, we got two. So he's mobile on both legs. Is there anything else I can do for you? And that would conclude our head to toe assessment. At this point, I would go ahead and report and document any and all of my findings. Thank you.